Good morning, everyone. My name is Braveen. I am one of our chief residents, and it is an honor to introduce one of my heroes, Dr. Perri Klass, today for Grand Rounds. Dr. Perri Klass is a professor of journalism and pediatrics at New York University and co-director of NYU Florence. She attended Harvard Medical School and completed her residency at Boston Children's. Her new book, A Good Time to Be Born: How Science and Public Health Gave Children a Future, an account of how victories over infant and child mortality have changed the world, was published in October by Norton. The New York Times said, A Good Time to Be Born is an ambitious, elegant meditation on what the doctor-writer, Dr. Perri Klass, describes as one of our greatest human achievements, a reduction in child mortality. She takes the most complex human patterns of all history, medicine, politics, art, and knits them into something unique and beautiful. Dr. Klass writes the weekly column, The Checkup, for the New York Times science section. She has written extensively about medicine, children, literacy, and knitting. Her journalism about medical training began when she was a student at Harvard Medical School and was the youngest journalist ever to write the HERS column. It is collected in her two books, A Not Entirely Benign Procedure, 4 years as a medical student, and Baby Doctor, A Pediatrician's Training, which were originally published in 1987 and 1992. And were reissued as classics of the genre in updated editions in 2010. Her most recent book of medical journalism is Treatment, Kind, and Fair: Letters to a Young Doctor. Her medical journalism has appeared in a wide variety of publications, including the Washington Post, the Wall Street Journal, the New Yorker, the New England Journal of Medicine, and Harvard Medicine. Dr. Klass is the National Medical Director of Reach Out and Read, a national program which promotes early literacy through pediatric clinics, with advice about reading aloud and children's books provided at routine well child visits. She ran the National Center from its inception through 2006, during which time the program grew from a single site to a national program with thousands of sites serving millions of children. The program now reaches 4.8 million children a year, 80% of whom are living in and growing up in poverty. Through her work at the Reach Out and Read National Center, she has trained thousands of medical providers in the Reach Out and Read strategies of early literacy promotion. She has spoken extensively on behalf of Reach Out and Read, including participating in panels at the White House Conference on Global Literacy in September 2006, and at the UNESCO Literacy Conference in Qatar and Mali in 2007, in addition to presentations at many hospitals and academic medical centers across the United States. Through her work with Reach Out and Read, Dr. Klass has been able to integrate her commitment to healthcare for young children with her love of the written word. In an essay on the program, she wrote, "When I think about children growing up in homes without books, I have the same visceral reaction as I have when I think of children in homes without milk or food or heat. It cannot be, it must not be. It stunts them and deprives them before they've had a fair chance." She has received numerous awards for her work as a pediatrician and educator, including the 2007 American Academy of Pediatrics Education Award, which recognizes her educational contributions, which have had a broad and positive impact on the health and well-being of children. And we are grateful for her to present to us this morning. Please join me in welcoming Dr. Perri Klass.
Thank you so much.
Do you see this book?
Yeah. Oh. I'm so delighted to be here. I thank you for that generous introduction. And I'm here to talk about something that you saw going by you when I first shared my screen. What can happen when we help a baby and a parent connect around a book? What it can mean, what we understand it can mean, and what we can build on as we think about what literacy promotion can mean in pediatric primary care, in our exam rooms, and increasingly also in our newborn intensive care units and in other settings where we have the opportunity to help parents develop the patterns that they will put into practice themselves every day in their homes, and that will shape their children's brains, their children's childhoods, those foundational, essential relationships, which mean so much, which mean everything as young children grow and learn. No commercial relationships, and the only product or device I'm going to discuss is really children's books, and so I don't think you would call this off-label use. Let's start by considering brain development, something that we all think about a great deal. And we know that early brain and child development happens in large parts through those contingent interactions, through those relationships, and that if we want to nurture healthy development, our best strategy for reaching children in the essential early months and years of life is to find ways to promote stronger parent-child relationships. What I'm talking about today, early literacy promotion, it's a strategy, it's a tested, evidence-based, really well-proven model for incorporating all of the principles of early brain and child development into clinical practice.
Do you see this book?
6-month-old.
Oh, yeah. And babies at this age love faces. They love to look at baby faces. Yeah. And it's such a nice age because they can sit up. He sits up so well. And sitting on the lap is a perfect way to look at books. We give out books starting at 6 months through 5 years of age at well visits to promote lifelong love of reading. And it's a program called Reach Out and Read. And so this will be Larry's first book, but not his last book.
Right.
And he's doing exactly what he's supposed to do with the book. That's what's so wonderful about board books is they're very sturdy.
Right.
They hold up really well, even to the teething baby. Look how excited he is about books. I mean, his arms out. He's smiling. He's interested. He's looking at the faces. I mean, that is. It's just wonderful. So, have you been reading with him?
Yes, I sit down and read with him. He eats the books, and I see that he sits for a little while, and then he cries, and I have to play something else. But I do sit with him and try to read.
If we were doing a formal training, we would watch this whole video, which would take about 2 minutes, and then we would talk about the different participants. We would talk about what you can observe in these 2 minutes in terms of the mother-child dynamic and the mother following her baby's cues and the child's development and how he reacts to the book and how he uses his whole hand. He's too young for a pincer grasp, and all the opportunities to talk about development and her sense of him and how she's doing exactly the right thing. She's following his cues. She's respecting his attention span, how you can build on that. And we'd watch the whole interaction, but we would also think about the pride that parents take, even in very young children, in seeing what kinds of cognitive and social emotional development are all wrapped up together in that interaction between an adult and a child when a book is in the picture. The messages for parents that we're trying to deliver here are these ideas that from the time a baby is very young, the books and the reading aloud can help the baby enjoy time with you and practice language and learn about the world, and that they can help you establish routines and structures even during very stressful times, because it's you, the parent, your voice, your presence. And the book becomes a way for the child to make sure, to follow you around the house with the book, to really saying, I want you. And those relationships and those routines, those bedtime routines, those transition routines, we all understand help your child handle challenges and stress. And while all of that is going on, and you are helping your child handle challenges and stress with these routines, with language, with affection, that a love of books and the language and communication skills that you're building are very profoundly important for school readiness and for how your child will do when it comes time to learn to read. Now, a lot of my job has been working with clinicians, and the messages that underlie this for clinicians, for those of us in the exam room, are very closely related. That supporting positive relations between parents and caregivers and children, that supporting those interactions is promoting healthy development. We all worry about the disparities in development and school readiness, which we know we see very early in the lives of young children and which can exacerbate inequities as the children grow. And we all know that promoting strong relationships which buffer toxic stress can help young children even in very difficult times. What we're looking for is ways to give support and guidance that build on parental strengths and can help establish those nurturing daily routines. So the Reach Out and Read model, which I think most of you are probably familiar with, is very straightforward. It's built to go on in a busy clinic. It involves anticipatory guidance at health supervision visits about reading aloud, about how to use books and reading to build routines and enjoy books with infants and toddlers and preschoolers. It's accompanied by a developmentally and culturally appropriate book at every health supervision visit from infancy to 5 years of age. And back in the days when we could do this, and we hope again, taking full advantage of waiting rooms to create literacy-rich environments with displays, with information, with gently used books, and even back in the other, of when we were able to do this with volunteer readers and people in the waiting room modeling for parents what it was like to look at books with children. The program began 32 years ago. It began as a collaboration between pediatricians and early educators. It's endorsed by the AAP. And when we started 32 years ago, our emphasis was really on reaching children growing up in poverty, children at risk for those educational disparities. But it's become very clear, both from working with parents and children and from working with pediatricians, that this is a message which needs to reach all parents and all children. And we've come to try to understand that the implications of this message around topics ranging from language to screen time to interactions, that these are messages that all children need. And just as we initially talked about literacy development and then about school readiness, we now try very hard to make it clear that this is part of our approach to early childhood, to early brain development, and to supporting and fostering contingent interactions and foundational relationships. The message, the single most important message for parents is I think the most strength-based message there could be. Your child will love books because your child loves you, wants to hear your voice, wants to be in contact with you in your arms, wants to hear you explaining and guiding into the world. So the actual substance of literacy promotion of this model is that from infancy through age 5 at well visits, we talk with parents about how important it is to read with young children, look at books with them. We model in the exam room what that means in a developmentally appropriate way with infants, with toddlers, with preschoolers, to look at the books, to talk about the books, to ask questions. We encourage families to cuddle up, to read together, to build those routines, and we give a new developmentally and culturally appropriate book to the child to take home and keep. And part of what I talk about and what we try to emphasize in the training is the importance of giving that book at the beginning of the visit and using it during the visit as a developmental surveillance tool, as a tool for modeling, as a way to not use literacy as a separate subject on your already very long primary care checklist, but as a tool which helps you do what you need to do in the visit as efficiently as possible. The 2014 AAP policy statement on literacy promotion, an essential component of primary care pediatric practice, recommended that we promote early literacy development as an important evidence-based intervention at health supervision visits for children beginning in infancy and continuing at least until the age of school entry, and recommended that all primary care include advising parents and caregivers, counseling them about developmentally appropriate reading activities. And remember, we're talking about starting with newborns. So when we say developmentally appropriate, it means incorporating it into visits with children who may be younger than parents would have expected to be thinking about in terms of books and reading. And that conversation, as we'll discuss with parents of newborns, may be more about talking and singing and reading and all of the different kinds of interactions which are so important. AAP recommended providing books at health supervision visits for all high-risk, low-income children, and then supporting and promoting these efforts with posters, parent information materials, and with advocacy around national messaging and policies and support for these programs.
Welcome. My name is Marilyn Augustin, and I'm a pediatrician at Boston Medical Center. I'd like to show you how a family experiences Reach Out and Read at our clinic and thousands of other clinics around the country.
All right, Dr. Klass, we can hear the video, but we can't see it.
The Reach Out process by commenting on the book the child will receive in a few minutes.
This is Amir.
Amir, okay. You're all set. Amir, you're going to get a book today. It's your 18-month
Hold
visit.
on.
So have a seat and someone will be with you.
Thank you.
Many Reach Out and Read clinics have a literacy-rich waiting room. A little table and chair creates an
Sorry. That was my technical incompetence. Can you now hear me again and see the slides again?
Yes, yes.
Okay, let me just keep going. And please don't tell my grown children that I did that. So what I was trying to say was that we find ways to integrate the Reach Out and Read and the literacy promotion into the different stages of the visit. I was trying to show you just a waiting area, and I was showing you here a prescription for reading. And again, coming back to this policy statement, which summed up the research as of 2014 and said that in populations at risk, participation in the intervention is associated with markedly more positive attitudes toward reading aloud, more frequent reading aloud by parents, improved parent-child interactions, improvements in the home literacy environment, and significant increases in expressive and receptive language in early childhood. So I want to touch on that research, which was reviewed in 2014 and is far more extensive and convincing and interlinked to when we look at it today. More positive attitudes toward reading aloud on the part of parents, caregivers, and children, more frequent reading aloud by parents, improved parent-child interactions, improvements in the home literacy environment, and significant increases in expressive and receptive language in early childhood. We also more recently have research to show that participation in the intervention is associated with stronger connections between parents and the medical home, increased compliance with immunizations, with well visits, and generally we've started to think much more about some of the other implications of using books to build bonds, not just within the family, but with the medical home, between the parent, the caregiver, and the clinician. There are now more than 14 published studies looking at the impact. Hold on. This is one of the early studies, one of the first to actually use randomized design with an intervention group and a control group. And after about a year in the study, the families, these are low-income Spanish-speaking families in Rhode Island, and after a year, the families in the intervention group getting the Reach Out and Read model, getting the books and getting the advice, 66% of the parents of toddlers reported reading 3 or more days a week, as opposed to 24% of the parents in the control group getting safety advice and devices when they came to primary care. And one of the important messages of this study, and again, this is a study from 20 years ago, but one of the important messages in this study is that if parents of very young children were not getting this message about books and reading aloud in the pediatric exam room, it didn't seem like they were getting it elsewhere in their lives. It seemed that not only did the pediatric primary care provider have an opportunity, but perhaps a unique opportunity to be talking about the importance of books and reading with parents of the very young. And this is a study on language skills, receptive language and expressive language. This is in a high-risk New York population. And the children who were tested, and they were tested directly with one-word picture vocabulary tests, they were tested in the preschool years at the age of 3 or 4, when language skills and vocabulary skills are really essential predictors of school readiness and even of school achievement. And the children who were participating in the Reach Out and Read program were 6 months ahead in their receptive language and 3 months ahead in their expressive language at that preschool moment. And just more generally, we have research showing pretty consistently that parents who are receiving this intervention are 2.5 times more likely to report reading to their children, that they're twice as likely to read to their children more than 3 times a week, that families are 2.5 times more likely to enjoy reading, to say they enjoy reading together when you ask what are their favorite activities, what do their children like to do, or to have books in the home. And that children's language development is improved, as you saw, 3 to 6 months in the preschool years, at a point when 6 months development really may mean the difference between being on track and not being on track. And in fact, that the language ability, the improvements are larger with increased exposure. There's a dose response effect. So we are a national program, as you know. We are now serving about 4.5 million children every year with over 33,000 medical providers who've been trained and who participate, and giving out books along with this guidance we're giving out 7.2 million books every year at more than 6,000 program sites. We are reaching, we think, about 1 of every 4 children growing up in poverty. And working through most of the residency programs. It's, you know, on the one hand, it's a wonderful thing to be able to say there's been so much uptake, so much enthusiasm by the pediatric community that we're now able to reach 1 of every 4 children in poverty. On the other hand, of course, you think about the children we're not reaching, and then you think beyond that about the sheer number and even more now of children who are growing up in poverty, in adverse circumstances, who are from the very beginning struggling against increased odds. I wanted to show you a picture of where things stand in the state of Pennsylvania, where there have been active Reach Out and Read programs now for decades, and where more than 158,000 children are being served annually, with more than 200,000 books distributed at 222 participating clinics. That'll give you a little sense of the distribution, and then of the background circumstances in Pennsylvania, where the surveys show that 60.7% of children growing up in low-income families are not read to on a daily basis, and 38% of 3rd grade students are not proficient on reading assessments. And you have a poverty rate of 17%. And all of these numbers, while depressing, are in fact, you have a state that is in many ways doing comparatively well. So what can books do if we do this? If we get them to families, but more important than getting the books to the families, if we model and encourage and support and help, what is it that we're hoping those books can do? This is an intervention which is actually letting you modify a child's home environment in a small but real way. If that book goes home, and tonight that book is in that child's bedroom, and from now on that house is a house with a book or with some children's books, what are we hoping that that can mean? We're hoping that the books will foster lap time and face time and physical affection, even in families that are stressed, that they'll be used to build daily routines to give children a sense of security and predictability, even in stressful circumstances, and that being able to establish those routines will strengthen parent self-efficacy, work against parental depression, and that by giving positive encouragement for lap time and human interaction, we'll be balancing out screen time with the serve and return interactions which build brains and helping to develop the kinds of family relationships which can buffer toxic stress for children, all through the language-rich interactions which help children develop the early language skills which they need for school, but they also need in order to express their needs and emotions and get those needs met. And what we hope is that children thus end up both with preschool language skills, which predict school readiness and reading and math success, but also with social emotional skills and familiarity and comfort around books. We're trying to help parents establish routines. That's why we're trying to start right at the beginning and talk about reading while nursing a newborn, reading to newborn infants, and thinking about the importance of having the right book at the right moment. What does it mean to choose books for very small babies? What does it mean to consider parent language preference and literacy level? How can we make sure that there's a rich, diverse choice of books for all families? How can we build the important routines at bedtime, at transition times, using books for distraction, bringing books along wherever you go? I want to talk for a minute about positive interactions with parents and caregivers and how important they are. We know now that early childhood experiences change the way that genes work, that they affect the way a child's brain forms and functions, and they build resilience to toxic stress, and that we're talking about cognitive and social emotional development with effects on health and well-being that reach into adulthood. And what we're basically talking about in trying to foster routines built on reading aloud is what are now called positive childhood experiences, with the goal that positive childhood experiences long-term can mitigate the effects of the adverse childhood experiences that we worry so much about. And this is a graph looking at the balance between having no adverse childhood experiences to 1 to 2 to 3 to 4 to 8 versus having 0 to 2 positive childhood experiences, 3 to 5, and 6 to 7. And again, nothing can completely mitigate the effect of multiple ACEs, but the positive childhood experiences can balance them out and can strengthen resiliency in children. And this was a 2019 study called Flourishing in Spite of ACEs that looked at children according to a child flourishing index. And flourishing was defined as children who were curious, who were able to complete tasks, and who were in control when faced with a challenge. And again, children who are exposed to more adverse childhood experiences are more at risk, but the more positive childhood experiences there were, the more likely you were to see resilience and flourishing, even in the face of ACEs. And one of the basic positive childhood experiences that has been looked at when we look at parenting in the face of early adversity is reading aloud. It's one of the positive parenting practices, reading a book together, storytelling, family meals, play. And so what we have here in literacy promotion, among many other things, is a very specific way to foster a built-in routine positive parenting activity, which becomes a positive childhood experience, which can mitigate toxic stress, which can work against the ACEs to which so many of the children we care for are exposed. And that being so, once we start to once we've started to think about reading as that positive childhood experience, what we're saying is those positive childhood experiences have an important role in defining the trajectory of a young child's life. We should be thinking about how to mitigate and prevent ACEs, but we should also be thinking about that strength-based approach of helping parents provide positive childhood experiences, because we in pediatric primary care, we have what nobody else has. We have a population level access to children in those critical early years when that brain is being built. We have a trusted relationship between clinicians and families with young children. And so, as I said at the very beginning, literacy promotion is a way to promote positive language-rich interactions between the parent or caregiver and the child around books, around language, and integrate that into early routine well-child visits. And those deep connections that you build in primary care with the families you take care of, and the fact that this model works in a standard busy clinic allows you to integrate that, makes it scalable. It makes it possible to do this in so many different communities and community settings. Okay, so we try very hard to start right at birth, but the messages, as I said, for the parents of newborns, the messages are that babies are listening and looking and learning. It's about talking and reading and singing and playing. You don't want the baby looking at the book. You want the baby watching your face as you talk and you read and you sing. If you're using the book, you're using it as a way to help talk, read, and sing and build these moments into your day with your baby, because even as a newborn, your baby knows and loves your voice. And we give guidance as babies grow, and I'm going to take you through to the age of 5, but I'm going to do it fast, just pointing to some of the most important age-appropriate emphases that we can look at. Holding and cuddling an infant, chewing board books is fine, but it's fostering the interaction. It's pointing at the pictures and naming them. It's relating the pictures to the baby's world. Where's the baby's nose? Where's mommy's nose? Oh, there's mommy's nose. It's slowing your voice and following the baby's cues and using those board books with faces and rhymes. And then by the time you get to a 1-year-old, you've got a child who can turn board pages and manipulate the book using a pincer grasp. 1-year-old will turn a book right side up if you give her the book upside down. Might be starting to name pictures, point to them, maybe beginning to complete familiar phrases, especially as you get to 15, 18 months. And you're talking to the parent about letting the child control the book, about responding when the child points, about those routines and distractions, and you're looking for board books and rhyming books and naming books that build vocabulary, and helping the parent appreciate everything, both cognitive and social emotional, that goes into the child's response as the child grows into that 2-year-old who can manage paper pages, who's got an increasing vocabulary that takes in so many familiar objects, maybe is beginning to put words together, wants repetition, wants familiar stories, finds them reassuring, and loves completing the sentence or the phrase or the rhyme in a familiar book. And so again, the guidance we're talking about is about being willing to read the same book over and over, asking questions. What's that? Where's the cow? What does the cow say? The routines, making book time into lap time so that the child handing you the book means I want to be with you, I want contact. And again, rhyming books, simple story books, books where you search and find, books that promote back and forth dialogic reading interaction. And then the 3-year-old who's going to turn pages in order deliberately, sit still for longer stories, answer more complicated questions, start to recognize letters on the page, especially the first letter of her name, might be pretending to read to dolls and stuffed animals. A 2.5 or a 3-year-old may have the whole book memorized, may turn the page at exactly the right moment because the child's got that early memory, knows exactly which words go with each picture. Child isn't reading. Child may not even really understand yet that you're reading at 2.5 going on 3. Child may think that you just happen to have a whole lot of books memorized, which is good, but hasn't necessarily yet figured out that what you're doing is decoding print. And that child, though, is going to figure that out. So again, you want to encourage parents, model for parents, asking more open-ended questions, making up stories together, letters, numbers, counting, exaggerating the sounds, and you can look at longer books, counting books, alphabet books, but also if you've got a child who wants dinosaurs, or you've got a child who wants dance, or you've got a child who wants moon and stars, you can start to find the books that interest a child and that the child can explain back to you. And then 4-year-olds are going to recognize numbers and letters. They're going to retell familiar stories. They're going to be able to make rhymes. You can talk with parents or model for parents, asking a child to tell the story from the pictures, pointing out the letters in the child's name, and connecting the story to the child's experiences, because books are also a way to talk about the child's experiences and feelings and emotions, and more finding the books about the things that the child likes best and wants to know about. Because one of the messages that parents are communicating here is that books are sources of pleasure and also sources of information. And when this child comes to school, the child is going to bring all of this, the print awareness, the letter naming, the sense of story and structure, but also the sense of feeling safe and the certainty that reading and books and decoding print, which the child will now understand holds the story, that all of this brings you both pleasure and information. You can tell from the way I talk about it that I love this program, that I think it's wonderful, but many of the families that we care for need more than literacy promotion. And I think it's important to say that one thing that these conversations can do in the exam room is that they can open doors to conversations about barriers and stresses within families. And I'm going to touch on a couple of issues which may mean that families need additional support, and that additional support and that need may be signaled in conversations about books and reading. One important issue is parents who themselves are struggling with literacy. This is not something we always know about the families we care for. It's probably something we should know, which parents really need extra help and support here. We can offer wordless books that are all about looking at the pictures. We can put aside the word read and talk about looking at books together. But although that may support the parent, it doesn't actually address the issue if the parent wants help. So we can also, when it's welcome, be on the alert to provide adult and family literacy referrals, because parents who are really struggling with literacy, that may be a health issue for the children, and it may be an educational risk factor as the children come to school and the parents have to deal with the educational system. We need to think also about parent mental health issues. A lot of the work we've done at Reach Out and Read during the pandemic has been to use the book and the reading and the routines as a way to talk about how parents are doing in this difficult time, and to be aware of the possibility that we may be able to refer parents for additional mental health services and additional support. And then the other huge area that I want to bring up is family stress, and the fact that as we're giving this advice and other advice, if we can, we have to find as many ways as possible to find out which families are under economic and other kinds of stress, and to offer referrals to social work and to community supports. And I want to make it absolutely clear here that I believe in literacy promotion. I love the idea that we can do this, but that we have to be partnered be cognizant of many other programs and resources for families who are going to need different kinds of assistance, from adult or infant mental health services to other programs that address developmental issues, parenting issues, adult literacy issues, legal issues, substance use issues, and that all of those questions can at times grow out of a discussion of building routines and looking at books with children. Children may have behavioral and developmental challenges, which come to light when you talk about how a child reacts when a parent talks about books. There may be attentional issues. There may be children for whom joint attention is an issue, raising neurodevelopmental questions, and there may be speech and hearing issues. So all of this is sort of the flip side of what I was saying. For all of the wonderful things that I was saying can happen around books, for all of those things to happen, the child has to be developmentally and behaviorally able to participate. The child has to not be struggling too much with speech and hearing issues. The family has to not be struggling too much with the whole range of issues that I brought up. And if all of those things are there and they're getting in the way of the family being able to follow your suggestions around literacy, they're getting in the way of a lot of other things as well. And I don't want to make it sound like any of this exists without reference to those other resources for families, to developmental screening and to referral for additional services. So at Reach Out and Read, we've tried hard to support pediatric primary care providers through the pandemic. We've tried to address their urgent needs during this hard time with immediate action, tried to figure out what was going on with them and the families they care for, and provide resources. We've done a lot around telehealth, looking for good, high quality, free ebooks that can be offered during telehealth visits, and developing a training video and tip sheet for how you can do literacy promotion through telehealth, but also how you can address the stress and anxiety of the time through shared reading, and use reading together to give children a sense of security, even in an insecure and anxiety-filled time. And we've emphasized the rollout of programs that stress the first 6 months of life, since those especially are the in-person visits, which were kept up even in settings where some of the older child well visits became virtual. Telehealth literacy promotion, as with many other aspects of telehealth, something that people have learned a lot about over the past year. Using the book as a way to ask what's working, to model sharing a book with a child over video, to ask the child to show you his or her favorite book, to ask in an open-ended way whether there are books in the home, ask the child to hold up a favorite book, model the back and forth of dialogic reading by asking questions. What's your favorite part? Tell me about the picture on the cover, and then expand on the child's answers, but also to suggest that the parent might read with the child during the visit, and then offer positive reinforcement and guidance, again, coming back to that strength-based message that your child loves to hear your voice, and talking about how reading and routines can create a sense of security and normalcy for children, and using books also to talk about screen time, to acknowledge the stress and anxiety of the pandemic period and acknowledge that patterns may change, but use the book to try to hold certain lines. No screens before bedtime is still tremendously important. It's still essential to have parent-child time that is screen-free, to have parents looking at screen media together with their children, and then on the other hand, acknowledging the very important aspect of using screens to connect with family and friends. And again, we've spent a lot of time and energy trying to assemble parent resources, good, high quality, multicultural ebooks. And at the same time, we've been thinking a great deal about how we can, going forward, help build change that incorporates the promotion of interactions and positive parenting into pediatric primary care going forward. And expand our training, look at ways of delivering books to families when the visits are virtual, and finding ways to use whatever modalities we have to promote the foundational relationships, both pediatric primary care providers and the parents, caregivers, and the children. And we want to do this as part of policy for the direction of pediatric primary care going forward, with the hopeful ambition of being part of converting all of the change and upheaval within pediatric healthcare into the kind of system change which will include the promotion of these foundational relationships as a standard of primary care. So coming back to books then, how do books build better brains? They promote the high quality language-rich parent-child interactions. Plenty of studies to show that the language in books is richer than just the language we use in everyday dialogue with our children. More complicated syntax, more varied words. Using books because they give us opportunities and prompts for serve and return interactions. Using books because they create face time and lap time, because they create those daily routines and rituals. Using books because reading aloud, reading with children contributes to parental well-being, decreased stress, and increased self-efficacy. Using books because children need to be exposed to print, letters, story structure, and sequence, the fundamental building blocks of emergent literacy. And they need to come to school with positive associations with books and stories, and that both of those pieces, the exposure to the print register and to the functions of books, the early literacy skill, the alphabetic skills, the phonemic skills, and also the social emotional skills, including the positive association with books and stories and the back and forth of the contingent interactions, contribute to school and preschool readiness. We know a great deal more than we used to know about the effects. This is from a study in which children were in a functional MRI in the dark, hearing a simple story told and looking at brain activation. And the results of the study were that children who had been read to more at home had increased children with greater home reading exposure had significantly higher activation in areas which suggested mental imagery and the extraction of meaning. And what I think you're seeing in these functional MRI scans of children sitting in the dark and listening to stories is that the children who've been read to are basically illustrating those stories in their brains. They are creating the images, they are integrating visual imagery with the stories that they're hearing. And then just offering you another relatively recent study looking at the complexity and richness of words in picture books versus the complexity and richness of words used in recordings of daily interactions between parents and children. And this is, again, make no mistake, I'm not talking here about any particular socioeconomic group. We all use richer, more complex language with our children when there are books in the picture than the language that we just fall back on in everyday life. We all enrich our children's lives by reading and by having books in the house. So books build better brains through responsive parenting, get parents engaged in helping children grow up with books, empower parents, believe in their power to help their children learn. Children grow up in a stimulating environment with supportive relationships, with routines. We try to help parents connect to the community, to resources, to the library. And the hope is that children will arrive at school with basic early literacy skills and a love of books. And of course that everyone will love going to the doctor. I have a collection of medieval and Renaissance paintings. And as you probably know, there's really only one child who makes it into most of the European art traditions in medieval times and even through the early Renaissance. And so if you want to look at paintings that will tell you anything about the way children are dressed or handled or thought about, you end up looking at paintings of the Madonna and Child. And I think it's interesting that there is an artistic tradition all over Europe of painting a Madonna and Child with a book. Here, this is a northern Madonna and Child, and you see the child is actually turning the pages, handling the pages. Look at the direction of the mother's gaze as she watches him. When this program started, we talked about fostering early literacy skills and language. It took us on to thinking about disparities in educational trajectories, early learning and brain development, foundational interactions, and parent-child parent-child interactions, thinking about buffering toxic stress, building family routines, promoting child resilience. But a lot of it comes back to this idea, which I think, I mean, I'm not an art historian or a religious historian, but I think that the painters who painted these paintings were showing us, in addition to all the other iconography, that there was something sacred about the mother, the child, and the book together. This is one other religious scene. This is the Virgin Mary's first reading lesson at the knees of her mother, Saint Anne, which is often depicted in stained glass or in marble, in statuary. Mary's first reading lesson at her mother's knee. And again, I think it's interesting that that is actually seen as a sacred moment. Here it is in carved gilded wood from a cathedral in Brazil. Once we go beyond our initial thoughts about what we can do in terms of language skills and vocabulary, we can start thinking about early math skills, helping parents use counting in dialogic reading. We can think more about ebooks and apps as ways of promoting parent-child reading and digital literacy. We need to look more carefully at the stress and emotional well-being of parents. And I think we also need to think about providers, about residents, about our own wellness, and the ways that literacy promotion can reinforce our sense of mission and our joy in pediatrics. Fostering early literacy skills, it's not one single trajectory. It means promoting multiple aspects of development. It means a chance to open many important conversations. It means thinking about social emotional development for children, for parents and caregivers, maybe even our own social emotional development, because children who are going to be ready in school to learn to read are children whose brains have been supported in their early growth and development. Here's one more of my Madonnas. You can see again the baby's head on the page. We talk about many aspects of these paintings and the way children are represented, but for purposes now, look at the hand on the page. Think about the ways that children handle books. The reason this is true is that for a child to learn to read in school, the child has to have so much going on: vision and cognition and memory, phonological awareness that P is a P, phonemic awareness that P-A is pa-a, vocabulary so that the words resonate, sequence and story and motivation, the desire to turn the page. And reading aloud to young children means that their brains are supported and nurtured during vital developmental windows, that families are maintaining the routines that create security, that children are learning everything they're learning, words and numbers and concepts and rhymes and stories and sequences, in the context of attention and affection, and that they're learning that books are sources of pleasure and information, and that their parents can help open up the world. And I'm going to finish with this Botticelli Madonna, which is a painting of many things. But what I want you to look at is that it is not to focus on the halos. This is a moment of joint attention, and it is being depicted as a sacred moment. Thank you very much.
All righty, outstanding. Thank you so much, Dr. Klass, for that wonderful presentation. I will invite anyone to please type any questions in the Q&A for this last few minutes. We have one question in the Q&A. If you might be able to describe how we can continue to encourage, reach on read and reading in general for our families in the long run and from a sustained effort, especially for our most vulnerable families?
I'm going to assume that that means, even beyond the age of 5.
Yes. Yes.
Long run. I think that's a really important question. When the program was built, the idea behind it was that, we'll get kids to school and then at least there'll be some other figure, some other person, some other entity in the child's life talking about reading and learning and the importance. But I think one of the things that we learn is how many of our families are sort of in multiple jeopardy. And so the families who are least likely to be able to maneuver with the school system, how do we support them? I think it's a question that goes beyond reading. We've all seen this, the family who, once the child gets to school, because of the parents' own level of comfort with literacy, maybe level of comfort with English, the children who don't get the services that they could get in school, the children who don't get everything that's there. And so I think that a large part of this is, for us, is to start thinking about this earlier, to actually give some voice to the worry that you have while a child is still in the preschool years, to the question of whether this is a family that really is going to need additional help to get all the services they're entitled to, whether this is a parent who's really intimidated, for example, by the school. What else? Community programs. There's a lot out there in many communities. There are a lot of programs. Nowadays, there are a lot of virtual programs that children could be taking advantage of for enrichment. And the other very practical thing that I would say that many programs do is you get a lot of donated books. And, we can't buy books for all the children, but can there be, and I think you've had this at your hospital, can there be a good curated collection of donated books so that older children are also able to get books when they come to the clinic? Can you connect people to everything I know there's stuff going on in your library system. And I know that their concern is that they probably aren't reaching the children who they think are most at risk. And you are. You have those children coming into your clinic, and those programs are out there. And how can you make the connection? And how can we make the connection even in these strange and complicated times?
Excellent. There's 2 questions we have here in our Q&A. One question is, as a subspecialist, how can we best be involved with Reach Out and Read, as we see our general primary care pediatricians have been some of the biggest champions, but I think that's a very great question and one we can look to see. And another question from one of our pulmonologists, Dr. Tracy Kazmierski: what is the biggest lesson in advocacy you've learned while building and expanding the Reach Out and Read program?
Okay, so let me say for the subspecialists, there's a wide variety. I mean, there are some subspecialties where actually functionally you end up doing much of the primary care role, as you know. And so depending on how you overlap with children's lives, our job at Reach Out and Read, or your way of collaborating with your colleagues, it probably parallels some of the ways that you collaborate around primary care. And if your clinic is in fact where parents are getting much of their guidance about their next steps with their children, we should make sure that you have all the resources and all the help and all the training. On the other hand, if you can, in all cases, reinforce what's going on in the primary care clinic, that kids are getting books, that parents are reading to their kids. If you can, in a subspecialty clinic in pediatrics, you are so often asking about some of these same questions. You're asking about sleep, you're asking about meals, you're asking about routines. I mean, one of the things that's interesting in pediatrics is you are talking about these questions in the GI clinic. You are talking, and so if you can keep in mind the question of encouraging that and supporting and talking, the other thing I would say about subspecialty clinics is that those are sometimes very overwhelmed parents because they're coping with children who have medical needs and medical issues, and to reinforce the need of the downtime, of the reading together, of these things that parents have it in their power to do. Let me answer the advocacy question. I also saw that Dolly Parton's Imagination Library was mentioned by someone in the chat. And yes, absolutely. There are other resources in your community. Getting children signed up for the Imagination Library so that they're getting books. In Cincinnati, there's a really extensive and more formal collaboration between Reach Out and Read and the Imagination Library. You can do more together. There, as we know, sometimes the most heartbreaking things about the most at-risk families is that there are services they could be getting, but somehow whatever the barriers are that have been created, they can't get them. So I do want to answer that question about the advocacy lesson. I'll tell you I can actually answer this. The most valuable thing I've learned is that we got off track when we separated out health and education in young children. Somehow, years ago, we decided that there were sort of two different pools of expertise. There was health, and that's us, and then there was education, and that's, you know, the teachers. And we have different research literatures, we have different vocabularies, we have different trainings, and we don't by and large learn from each other. But what we all know, and I think teachers know it too, is that in young children, there is no such thing as health without education or education without health. If something is going wrong for young children in their bodies, in their brains, then it shows up, just as it shows up by not growing properly, it shows up not learning properly. Learning is their business. And so if we could stop separating those, and I learned this in advocacy because when we went begging for money for Reach Out and Read, we would sometimes hear, oh, you know, your doctors, go on over and talk to the health people. Oh, you're talking about books, go on over and talk to the education people. And that doesn't work. It doesn't work for getting money for books, but it doesn't work as a way of thinking. We need to be, as pediatricians, as people who think about children's health, as subspecialists, we need to be at the table for talking about learning, and we need that learning expertise at the table with us when we think about health and early brain development.
Thank you so much, Dr. Klass, for your amazing example and inspiration for us. We're so grateful that you took the time to share Grand Rounds with us. We invite everyone to join the meet and greet, or those who are able to right after this. The link is in the chat. And thank you so much, everyone, for joining for us for Grand Rounds today.
Thank you. Thank you. Thank you.